Just a nurse. That's what Dr. Mercer said 8 months ago when Megan O'Brien arrived at Cedar Creek Medical with an unremarkable resume and a transfer request that raised no flags. Just a nurse. Civilian. Mid-level credentials. No publications, no prestigious fellowships, no pedigree worth noting. He didn't know that she had held a field hospital alone for 16 hours under enemy fire at Bagram Airfield while helicopters screamed overhead and the walls bled dust. He didn't know that the hands securing full lines with surgical precision had spent 3 tours in provinces he couldn't find on a map. And he had no idea that the slight limp on her left side came from shrapnel that nearly killed her, or that she touched the folded flag in her locker every morning, colors from a teammate who didn't make it home, before she clocked in. The pediatric ICU at Cedar Creek had no idea it was harboring a legend. What happened next would change that forever. Cedar Creek Medical sprawled across San Antonio like a small city unto itself. 17 stories of glass and steel. 3 operating theaters. 2 trauma bays. And 1 pediatric intensive care unit on the 4th floor where the smallest patients fought the biggest battles. The fluorescent lights hummed their fluorescent song at 4 in the morning, the kind of hum that never stopped, never changed, a white noise heartbeat that replaced sleep for anyone who worked here long enough. The antiseptic smell hung in the corridors like a chemical fog, sharp, clean, metallic. Megan moved through it like she was reading the air itself, her eyes tracking the placement of monitors, the positions of staff, the flow of equipment, the way most people registered exits and entry points in an unfamiliar room. Threat assessment. Muscle memory. 15 years of it, 4 of those in uniform and 3 of those in active theater. She was moving through the pediatric ICU at 4:17 in the morning, 2 hours before shift change, when she noticed it. Before set up on Bay 4, where a 6-year-old girl named Emma Hayes had been admitted 3 days ago with a fever that wouldn't break. Megan glanced at the lot number on the saline bag. Her eyes didn't change. Her hands didn't tremble. But something inside her shifted, locked into place, the way a rifle bolt locks when you chamber a round. She committed the number to memory, 847 B. Sac, 2019, and moved on to the next patient without pause. The blind child in Bay 4 couldn't see the way Megan's jaw tightened almost imperceptibly. Nobody saw that. Emma Hayes was small. 6 years old, which made her smaller than most 6-year-olds, her body consumed by recurrent infections that no specialist had been able to trace. Sepsis 3 times in 4 months. Fever spikes that lasted 72 hours. Recovery, then infection again. The pattern didn't match any bacterial profile in the literature. The pattern didn't match anything except bad luck or something environmental that everyone had missed. Megan had read the chart twice. She had read it with the kind of attention that combat nurses develop, the kind of attention that keeps people alive when protocols fail and the system breaks. Emma's mother had stopped coming to visit after day 5. Her father, a Navy SEAL commander named Hayes, sat in the corner of the bay every evening after his command duties ended, holding his blind daughter's hand and saying nothing, because there was nothing to say. Megan had been at Cedar Creek for 8 months. 8 months of working day shifts and swing shifts and night shifts in rotation, building her cover, establishing her presence in the pediatric ICU without standing out. 8 months of being invisible. 8 months of watching. That was the job. That was the actual job, the one nobody knew about. The nursing license was real. The competence was real. The careful way she moved through patient care without drawing attention was calculated. But the infections in the pediatric ICU, for children in 8 months, 3 of them fatal, those were real too, and they were wrong. They were shaped wrong. They followed patterns that didn't occur in nature, patterns that occurred when equipment wasn't sterile, when maintenance logs weren't followed, when someone was either catastrophically incompetent or deliberately contaminating. Megan had photographed the maintenance logs in the supply room. She had photographed the lot numbers on the equipment in Bay 4. She had cross-referenced Emma Hayes' infection timeline with the equipment rotation schedule, and 3 lot numbers appeared in both. The same saline bags. The same for tubing. The same port placement supplies. It was thin. It was circumstantial. But it was a line, and she was going to follow it until she understood what it meant. The first person to notice that something was different about Megan O'Brien was Dr. Marcus Mercer, the attending physician who had run the pediatric ICU for 19 years, and he noticed it for exactly the wrong reasons. He noticed it on her 4th week at Cedar Creek, during a routine port placement on an 8-year-old patient with cystic fibrosis. Megan had assisted. The port went in cleanly, too cleanly. The stitches were perfect. The technique was not something a floor nurse learned from a standard training protocol. The technique was something you learned when you had spent 300 hours in field hospitals where mistakes meant people died, where you couldn't afford sloppy suture work, where your hands had to move with the kind of precision that most surgeons took years to develop. Dr. Mercer watched her secure the final stitch, her hand steady as a surgical laser, her movement economical and flawless, and something cold moved through his chest. He was not a generous man. He was a man who had climbed 17 stories to the top of a hospital hierarchy through careful cultivation of indispensability. He was a man who had published 12 papers and cultivated relationships with 3 board members and positioned himself as the only person in San Antonio who truly understood pediatric intensive care. He was a man whose authority was built on the fact that nobody else in his department was quite as competent, quite as essential, quite as irreplaceable. And now there was a nurse with an unremarkable resume and a transfer request that raised no flags, moving through the pediatric ICU with a kind of unconscious competence that suggested she could probably run the whole place if she wanted to. That was unacceptable. Dr. Mercer smiled at her after the port placement was complete. It was not a kind smile. "Impressive work, Ms. O'Brien. Where did you learn to suture like that?" Megan didn't meet his eyes. She was already moving to dispose of the sharps. "Online course. A lot of nurses do them these days." Her voice was soft, deferential. Exactly what a junior floor nurse's voice should sound like. Just trying to stay current. He watched her dispose of the needle with perfect care. He watched her document the placement. He watched her move on to the next patient without drawing attention. And he began making phone calls. Not immediately. Not in any obvious way. But starting that week, Dr. Mercer began the careful work of poisoning the well. It wasn't direct. It was never direct. Mercer was too intelligent for that. He mentioned, casually, to Nurse Chen, that he'd heard from a colleague that Ms. O'Brien had been fired from her previous position for protocol violations. Just a rumor. Just something floating around. He didn't originate it. He was simply passing along what he'd heard. By the 2nd week, the rumor had evolved. She hadn't just been fired. She'd been fired for unauthorized treatment recommendations. She'd overstepped her scope of practice. She'd potentially harmed a patient. The details were vague, but the implication was clear: she was a liability. By the 3rd week, the nurses in the pediatric ICU began to move around Megan differently. There were no longer casual conversations near the supply station. When she sat in the break room, the other nurses would exchange glances and suddenly remember they had tasks elsewhere. Chairs would scrape back. The exodus would happen almost in unison, coordinated without being discussed. Megan would sit alone with her coffee, her jaw tight, her hands wrapped around the cup. But she didn't crack. She didn't ask what was happening. She didn't defend herself. She simply continued her work with the same calm precision, and every morning she went to her locker and touched the folded flag that carried the weight of her entire life compressed into fabric the size of a shoe box. Dr. Mercer watched this happen. He watched the isolation take root. He watched her move through the pediatric ICU with increasing invisibility. And he smiled to himself, because in his mind, the threat had been neutralized. She was no longer a problem. She was just a nurse. A junior nurse. An unremarkable nurse. A nurse that nobody in the hospital respected or valued or believed. Which meant that when she tried to raise questions or concerns about anything, about protocols, about equipment, about patient care, nobody would listen. Nobody would care. She was already isolated. she was already discredited. The work of destroying her authority had already been done. What Dr. Mercer didn't know was that Megan had expected exactly this. It was Dr. Patel who broke the silence. Dr. Anish Patel, a former Army combat medic rotating through Cedar Creek on a clinical fellowship from Walter Reed, who had spent for years in Helmand Province as a field surgeon's assistant and recognized things that most people in a hospital would never see. He noticed her during an emergency port placement on a 7-year-old patient with leukemia, when Emma Hayes' feeding tube had shifted and Megan had to assist while the patient coded and everyone's hands were shaking except for hers. Patel watched her hands move. He watched her call out vitals with the kind of calm that only comes from having done this before, really done this, not in a simulation, but in a tent with incoming fire and inadequate supplies and the sound of rotor blades and people screaming. When the crisis passed and the child's rhythm stabilized, Patel caught Megan in the corridor. He didn't say anything at first. He just studied her face with the kind of recognition that couldn't be faked or mistaken. His eyes moved across her features like he was reading something written in a language nobody else understood. "How many tours?" he asked quietly. Megan didn't break stride. She kept moving. "I don't know what you mean, doctor. The suture technique. The threat assessment. The way your hands didn't shake when the monitor started screaming." Patel kept pace with her. "How many?" She reached the medication station. She pulled up a chart on the computer. When she spoke, her voice was barely above a whisper. "That's classified." Patel nodded slowly. He didn't ask any more questions. But after that moment, something shifted. He began to sit near her in the break room. He didn't talk much. He just sat there. And very gradually, the coordinated exodus stopped happening as often. The other nurses seemed less certain about whether they should leave when she arrived. Patel's presence implied something different, implied that maybe they didn't know the whole story. Implied that maybe there was more to Megan O'Brien than her unremarkable resume suggested. But that didn't stop Dr. Mercer from filing a formal written warning 3 days later. It appeared on the unit board, printed on official hospital letterhead, citing insubordination and unauthorized treatment recommendations. Megan read it. She initialized it. Her hands didn't tremble. Her jaw tightened, just barely, but she signed her name in the space provided and moved on to the next patient without acknowledging it. The room went dead silent when she did it. Nobody moved. Nobody breathed. That evening, in her locker, she touched the folded flag. She held it for exactly 3 seconds. Then she closed the locker, secured the combination lock, and clocked out. The morning rounds at Cedar Creek Medical moved with their usual rhythm, monitors beeping in steady intervals, the fluorescent lights casting everything in that institutional pallor that made healthy skin look faintly diseased. Megan had been there 8 months. Long enough to know which nurses took their coffee black, which doctors preferred their charts organized by date versus by system, which supply carts squeaked loudest when pushed down the 3rd-floor corridor. Long enough for Dr. Mercer to decide she was a threat. She stood in Emma Hayes' room with the child's chart open in her hands, the pages covered in her own neat handwriting, observations about the pattern of infections, the timeline of hospital admissions, the medications administered. Emma sat cross-legged on the bed, her small blind eyes tracking the sound of Megan's voice rather than her movements, the way she did with everyone. Commander Hayes stood on the far side of the mattress, his massive frame somehow made smaller by the weight of his daughter's illness, by 6 weeks of watching specialists fail her. "How is she doing today, Nurse O'Brien?" The commander's voice carried the rasp of a man who'd stopped sleeping properly. Megan was about to answer when Dr. Mercer appeared in the doorway, his white coat somehow immaculate despite the early hour, his face arranged in that expression he reserved for moments when he was preparing to plant a knife. "Commander Hayes, I'm glad you're here." Mercer stepped into the room like he was entering a stage. "I was actually hoping to discuss some concerns about the care your daughter's been receiving." Megan's jaw tightened. Fractionally. Barely a muscle movement. Her hands remained perfectly steady on the chart. "What kind of concerns?" The commander's protective instinct sparked immediately, a trained soldier recognizing a threat in tone rather than words. Well, Mercer said, positioning himself between Megan and Emma like a territorial animal, I'm somewhat troubled by the recommendations Nurse O'Brien has been making regarding your daughter's treatment protocol. It's caused me to review her background, and I have to say, the information I'm receiving is quite inconsistent. Megan watched him with the kind of stillness that comes from having already decided how to respond. No defensiveness. No explanation volunteered. Inconsistent how? Commander Hayes asked. Her credentials, for one, Mercer continued smoothly. I'm hearing she departed from her previous position under somewhat questionable circumstances. I'm wondering if perhaps she was asked to resign? Terminated? The details seemed to be unclear. He glanced back at Megan with a smile that didn't include his eyes. Perhaps you could clarify for the commander, Ms. O'Brien? Were you fired from your last hospital, or did you resign? The room temperature seemed to drop. Emma reached out toward the sound of her father's breathing, her small hand finding his arm. Megan closed the chart with measured precision. When she spoke, her voice was perfectly level, the voice of someone reading a grocery list. My credentials are on file with Human Resources, Dr. Mercer. They've been verified. That's not what I asked, Mercer pressed, his tone sharpening with the pleasure of having gotten a response. I asked whether you were. I was reviewing Emma's lab work before you arrived, Megan said, her attention returning to the child as if Mercer had ceased to exist. I'd like to discuss the pattern of her infections with you and the commander, if you have a moment. She moved to the bedside and took Emma's small hand, continuing her assessment as though the confrontation hadn't happened. The commander watched the exchange with growing confusion and something that looked like respect. Mercer's face darkened slightly at being dismissed, but he'd planted what he came to plant. Doubt. Suspicion. A seed that would grow in the minds of everyone within earshot. It was a technique as old as hospitals themselves. Destroy credibility quietly. Let others do the actual destruction. 2 days later, the break room operated like a social ecosystem that had just shifted its dominant hierarchy. Megan sat at a table with her lunch, a salad, water, a protein bar she'd brought from home, and watched as 3 nurses simultaneously recognized her presence and executed what could only be described as a coordinated departure. The first stood abruptly, her chair scraping across the linoleum with sharp violence. The second and third followed within seconds, their movement synchronized like a rehearsed maneuver. Chairs dragged. Lunch trays collected. The table emptied around her like water rushing down a drain. She ate her salad. She didn't look up. Her hands didn't tremble. Dr. Patel hesitated in the doorway, his lean frame silhouetted against the harsh light of the hallway, his eyes flicking between Megan and the departing nurses. For one moment, just long enough for Megan to feel it, he seemed about to approach her. Instead, he turned and followed the others out, leaving her alone in the break room with the sound of fluorescent ballasts humming their endless electronic drone. Muscle memory was a strange thing. It lived in your hands, your posture, the exact angle of your shoulders when you were perfectly aware of threat assessment without allowing it to register on your face. Megan had spent 16 years developing that muscle memory. 8 months of civilian nursing hadn't remotely diminished it. The third humiliation arrived printed on bright yellow paper. She found it posted on the unit board during the afternoon shift, a formal written warning, dated and signed by Dr. Mercer, printed in the officious language of someone who understood that documentation was power. The charges were carefully worded, insubordination and unauthorized treatment recommendations regarding the Hayes pediatric case. Scope of practice violation. Failure to defer to attending physician authority. Every word was designed to sound professional while actually meaning nothing. Scope violation for reviewing lab work. Insubordination for continuing patient assessment. Unauthorized recommendations for asking a question. Megan walked up to the board, read the warning in its entirety, her eyes tracking every word with the methodical thoroughness of someone who'd done this before. She didn't flush. She didn't take the paper down or look for anyone's reaction. She simply pulled a pen from her pocket and initialed the document with her signature, clean, controlled, perfectly centered in the space provided. Her handwriting never wavered. Behind her, Two nurses whispered in the way people do when they want to be overheard. I heard she got someone killed at her last hospital. Mercer says her references don't check out. Megan capped her pen, pocketed it, and returned to work. But that wasn't the worst part. The worst part was watching the strategic nature of what Mercer was doing. This wasn't random bullying. This was institutional assassination. He was building a paper trail, creating documentation, establishing a narrative that would hold up under scrutiny. He was using the hospital's own systems, the break room gossip, the formal warning, the whisper campaign among staff, as tools to accomplish what no single action could achieve alone. He was making her radioactive. During an emergency port placement later that shift, Megan guided the needle into the subclavian vein with the kind of precision that came from muscle memory calibrated through hundreds of procedures. 2mm needle, skin prep with chlorhexidine, angle of entry exactly 45 degrees. The thread went in clean. No fumbling. No hesitation. She sutured the line closed with stitches so small and regular they looked like they'd been placed by a machine programmed for perfection. Dr. Patel watched from across the patient's chest. Watched her hands move. Watched the exact angle of her shoulders. Watched the way she monitored the monitor without looking at it, reading the O2 saturation by the quality of the beat the way some people read music. When the procedure finished, Patel caught her gaze for exactly 2 seconds. In those 2 seconds, something passed between them that didn't require words. Recognition. Assessment. The kind of knowing that happens between people who've been trained by the same institution, spoken the same language, survived the same things. 15 years ago at Bagram, he said quietly, once they'd cleared the room and were disposing of equipment at the nursing station, there was a Navy nurse attached to my unit. Call sign Iron Angel. Best trauma surgeon I've ever seen without a scalpel. She could start lines faster than I could direct traffic, manage an airway blindfolded, stop bleeding that would have killed most people. He turned to face Megan directly. I spent 3 years looking for her after rotation ended. Never did find her? Megan's hands paused for 1 beat. 1. Then continued their work, disposing of sharps, peeling off gloves, moving with the same methodical precision. You're mistaken, she said. Maybe, Patel said. But he looked at her the way soldiers look at other soldiers when the veil slips for just a second and they see the truth underneath. That evening, Dr. Mercer made 3 phone calls from his office with the door closed. The first was to a board member he'd mentored 15 years ago, a man who owed him professional favors accumulated like compound interest. The second was to a contact at the state nursing board, someone who'd always been willing to review disciplinary files if proper channels were observed. The third was to a background investigation service that specialized in pre-employment screening, with a specific request for inconsistencies in employment history. By 9 p.m., the wheels were turning. Quietly. Professionally. The way institutional machinery always turns when someone decides to destroy you, or not with violence, but with paperwork. With procedure. With the absolute certainty that if you go through the proper channels, the system itself will do your work for you. Emma Hayes coded during a routine assessment the next morning. Megan was alone in the room when it happened. One moment the child was breathing normally, complaining about needing to use the bathroom, asking why nurses asked so many questions. The next moment, Emma's small chest simply stopped moving. Her lips turned the color of old bruises. The monitor began to scream. Emma's chest rose and fell like a bird trapped in a cage. Not normal breaths. Shallow. Frantic. Her small fingers clawed at the blanket, searching for something to grip, and Megan was already moving before the monitors screamed their alarm. The pulse oximeter descended like a stone, 94, 87, 79. The heart rate climbed in compensation, a desperate gallop that couldn't sustain itself. Commander Hayes stood frozen at the bedside, his weathered face crumpling as he watched his 6-year-old daughter's lips lose their color. Megan's hands moved on their own. She positioned herself at Emma's right side, her movements fluid as cold water. Assess. 2 seconds. Absent breath sounds on the right side of the chest. distended neck veins standing out like tent ropes. The trachea deviated left, pushed by invisible pressure building in the child's chest cavity. Tension pneumothorax. A collapsed lung trapping air that compressed the heart with every failed breath, stealing time she didn't have. "I need a 14-gauge angiocath needle, now," Megan said. Not a request. A command. The clinical voice that hadn't been heard in this hospital, the one she'd buried under months of careful subordination. Her jaw was stone. Her hands were steady as surgical steel. The responding nurse froze in the doorway, eyes wide, waiting for permission that wasn't coming from anyone else. Megan reached for the crash cart herself, fingers finding the needle kit in the chaos of supplies. 60 seconds. Maybe 90 before Emma's heart collapsed entirely under the pressure. Maybe less. Dr. Mercer appeared in the doorway like he'd been waiting for this moment. His expression shifted from clinical concern to something predatory, something that looked almost like satisfaction. He took in the scene, the gasping child, the desperate father, the nurse with her hand on emergency equipment, and he understood. This was the vulnerability he'd been hunting for. This was the moment to destroy her completely. "Step back, O'Brien. You are not authorized for surgical procedures." His voice cut through the room like broken glass, loud enough for everyone to hear. The final accusation. The proof he'd need. "She has a tension pneumothorax. She'll be dead in 3 minutes," Megan said. Her voice hadn't changed pitch. Hadn't wavered. Just stated fact the way the heart monitor stated vital signs. "I said step back. That is an order." Mercer moved toward Emma, reaching for the equipment with the deliberate slowness of a man making a performance. He had no idea what he was looking at. His hands were soft. His movements uncertain. A man playing doctor in front of witnesses. Commander Hayes made a sound like something breaking inside him. His blind daughter was turning the color of bruises, gasping for air that her own body wouldn't allow. His hand reached for Emma's face, trying to comfort her, trying to do anything but watch. Megan grabbed the needle kit from the crash cart anyway. The plastic crinkled in her grip. She prepped Emma's chest wall with an antiseptic pad, the sharp smell of chlorhexidine cutting through the sterile air of the room, her fingers finding landmarks with muscle memory that lived deeper than consciousness. Second intercostal space. Midclavicular line. The anatomical map written in her nervous system from 16 years of field medicine, from holding lives together in places where there were no protocol committees and no administrative boards, only the choice between action and death. "You're finished, O'Brien," Mercer hissed, but she was already counting ribs beneath Emma's pale skin, already positioning the needle against the child's chest wall. 1 motion. 2 inches of movement, smooth and decisive as a conductor's baton. The needle found the space between ribs and bone and the trapped air in Emma's chest cavity. The hiss of escaping pressure was the sound of a tire deflating, except this tire held a child's life. The sound of rescue. The sound of protocol violation that would cost everything. Emma's spine arched as her lungs suddenly expanded, as oxygen flooded the space where pressure had suffocated her just seconds before. Her mouth opened in a gasp so profound it seemed to pull air from the entire room. Color flooded back into her face like sunrise over Bagram, like life itself rushing back in. The pulse oximeter climbed, 85, 92, 98. Her heart rate began its descent from panic, slowing toward something sustainable. Commander Hayes broke down. His shoulders shook, his hands covering his face, then moving to hold his daughter's face, to press his forehead against hers, tears running without apology. His little girl was breathing. His little girl, whose eyes had never seen his face, was breathing, was alive, because this woman had moved faster than fear and pushed back against a doctor's ego to save her. "Security," Dr. Mercer said quietly. Politely. Like he was ordering coffee. "Get her out of this hospital. Now." Megan stepped back from Emma's bedside. She had done what needed doing. She had saved the life that every other specialist in Cedar Creek had written off as untreatable. She had blown her cover. She had compromised 6 months of undercover work, had destroyed her fabricated credentials, had handed Dr. Mercer exactly the violation he'd been manufacturing evidence for. And she had kept a 6-year-old girl breathing. The security officers moved toward her with the awkward certainty of men who'd been given an order they didn't understand. One reached for her elbow. Megan didn't resist. Resistance would only give Mercer more ammunition, more witnesses, more documentation for the case he was already building. She let them guide her toward the door, her eyes meeting Commander Hayes's for a fraction of a second. Understanding passed between them, wordless, complete. "You know what I am. You know this is wrong. And you can't say anything." That evening, by the time hospital security had escorted her from the building, by the time she'd handed over her badge and her access codes, by the time she'd walked through the parking lot in scrubs still damp with Emma's sweat and the antiseptic smell still clinging to her skin, Dr. Mercer had already activated his network with the precision of a man who'd been planning this endgame for months. 3 phone calls to board members who owed him favors. A formal complaint to the state nursing board citing her previous termination, the fictional one, the one he'd fabricated but documented with meticulous care, for protocol violations. For insubordination. For unauthorized treatment recommendations. For exactly what she'd just done. The emergency review panel convened by morning, stacked with his allies, moving with the momentum of institutional protection. Outside investigators they didn't know had already begun digging into her employment history, pulling threads on a resume that had been constructed with the precision of a SEAL insertion plan but was nonetheless a fabrication. They would find discrepancies. They would find inconsistencies. They would find exactly what Mercer had planted for them to find. By noon, hospital security had suspended her credentials pending investigation. By 1 o'clock, the state nursing board had issued a preliminary suspension. By 2 o'clock, Cedar Creek Medical had officially terminated her employment, and Dr. Mercer had successfully removed the one nurse in the hospital who knew that his contaminated equipment had killed 17 pediatric patients in the last 8 months. The one nurse who had traced the pattern. The one nurse who had been documenting everything. The one person close enough to Emma Hayes to prove what he'd done. Megan drove home in scrubs, the folded flag of her fallen teammate still tucked in the side pocket of her jacket where she'd carried it for 6 years, a weight against her ribs that no one else could see. The contaminated equipment was still in Cedar Creek. The children would keep dying. The investigation was blown. Her mission was compromised. Everything she'd sacrificed to build was ash. That evening, her 8-year-old son found her sitting at the kitchen table still wearing her scrubs, still wearing the hospital ID badge that no longer meant anything. He asked why Mommy was home so early. She had no answer that wouldn't terrify him. So she held him instead, and let him ask questions she couldn't answer, and felt the weight of the one thing she'd done right, a blind girl breathing, alive, because a captain had refused to obey a doctor who didn't understand that the quietest person in the room was the one holding it all together. Within the hour, Dr. Mercer locked himself in his office and made 3 phone calls. The first to board member Sterling, who'd voted for his promotion 8 years ago. The second to board member Pierce, whose daughter had married Mercer's cousin. The third to board member Bancroft, who still owed him a favor for recommending his son for a surgical fellowship that had cost Mercer nothing but carried the weight of institutional obligation. Each call lasted exactly 2 minutes. Each call contained the same narrative, an unauthorized procedure, a nurse acting outside her scope of practice, credentials that didn't align with her references, a liability that could cost the hospital millions if she sued them first for wrongful termination. By 1 p.m., the state nursing board had received a formal written complaint. By 2 p.m., an emergency review panel had been convened. By 3 p.m., Mercer sat across from the panel via video conference, his voice measured and concerned, painting a picture of a dangerous practitioner who'd exploited a family tragedy for attention. He submitted documentation, forged, but documents nonetheless, showing employment termination at a hospital in Austin 7 years ago for unauthorized treatment recommendations and protocol violations. The board members nodded, concerned, professional. One of them asked if he had any recommendations for remediation. Mercer said he believed the safest course was immediate credential suspension pending full investigation. No one disagreed. Security escorted Megan from Cedar Creek Medical at 11:24 a.m., a folder in her hands containing her badge, her credentials, and a letter stating that her nursing license was under suspension effective immediately. Commander Hayes watched from the pediatric unit doorway, his daughter Emma stable now, breathing normally, and his face was the expression of a man watching his daughter's savior being removed from the building by security like a criminal. He didn't yet understand what had happened. He understood only that the nurse who'd performed a procedure that every other doctor in Cedar Creek had deemed impossible, the procedure that had brought his blind daughter back from the edge of death, was now being escorted down the corridor with her hands full of termination papers. The fluorescent lights overhead cast everything in sterile white. Her boots, the same combat boots she'd worn every shift since she arrived at Cedar Creek, made no sound on the linoleum as the security guard walked beside her, professional and detached. She didn't look at him. She didn't look at the nurses staring from behind the nursing station. She kept her eyes forward, her jaw set, her shoulders level. That was composure. That was discipline. That was the posture of someone who'd held a hospital alone under fire and wasn't about to break in front of an audience. That evening, Megan sat at her kitchen table in her San Antonio apartment wearing the same scrubs she'd worn during the Code Blue, the fabric still tacky with dried perspiration and antiseptic. Her apartment was small, functional, impersonal, the space of someone who'd never planned to stay long, had learned a long time ago not to leave marks. On the table before her sat a folded flag. Not the American flag. This was the combat colors from Petty Officer Martinez's unit, faded desert tan and blood brown, folded into the precise triangular military shape. She'd carried it for 6 years in a bag at the bottom of her locker, brought it out only at 3 a.m. when she couldn't sleep and the weight of decision she'd made sat on her chest like a sandbag. The flag represented 16 hours. It represented for patients who died despite her best work. It represented the one thing she could never undo, could never fix, could never apologize for well enough. Her 8-year-old son, Marcus, came through the front door at 3:15 p.m., his backpack slung over one shoulder, his face confused. He was supposed to be at after-school care until 5 p.m. Pine Grove Academy didn't release kids early. Something had happened. She watched his expression change as he saw her, not surprise, but the particular kind of fear that children develop when their world shifts off its axis. "Mommy? Why are you home early?" His voice was small. He was a perceptive child, too perceptive for his age, had learned to read silences and absences the way other kids read picture books. Megan looked at her son and felt something in her chest fracture. She reached for him, pulled him close, his head coming to her sternum, and he smelled like the pine-scented soap from school, like pencil shavings, like the normal world that she'd been trained to move through like a ghost. "Mommy just had a hard day, baby." The words were automatic. They weren't true. The truth was worse. The truth was that she'd been burned. The truth was that 3 months of undercover work had vaporized in the time it took for Dr. Mercer to make 3 phone calls. The truth was that Emma Hayes had nearly died because Megan had been the only person in that room who understood what was happening, and now Megan was fired, suspended, and facing federal charges for practicing medicine without authorization, charges that would hold up because her nursing credentials, the ones that said she was just another RN, had been fabricated so carefully that even she sometimes forgot they weren't real. Marcus pulled back, studying her face with the scrutiny of a child who'd already learned that mothers lie when the truth is too heavy. "Did someone die? Are you sick?" His voice was frightened now, and she hated herself for the fear she saw there. "No, sweetheart. Nobody died. Mommy's not sick. Work was complicated today." She held him until the tension in his small shoulders eased, but she could feel him not believing her, could feel the beginning of his own training in how to read silences, and that hurt worse than the suspension letter. Later that evening, after Marcus was asleep and the apartment was dark except for the single lamp in the living room, her phone rang. Unknown number. She knew exactly who it was. Navy handlers didn't call from recognizable numbers. She answered without greeting. The voice on the other end was clipped, professional, the accent faintly Boston. "Operation Lighthouse is compromised. Cedar Creek Medical is now under CDC investigation for contaminated equipment. 3 children were infected. 1 death occurred 6 months prior. We have the documentation. The words arrived like shrapnel. Megan had known this was coming. She'd been documenting the contamination pattern since she arrived, each infection a breadcrumb leading back to a supplier in Houston, each death a confirmation of her theory. But knowing something was coming and hearing it confirmed were different things, were separated by the distance between preparation and impact. Yes, sir. Your cover is burned. You are to extract immediately. Naval Intelligence is assuming control of the investigation. You will be debriefed at Naval Air Station Corpus Christi on Friday. My son will be briefed on your operational status. This was always a possibility in your custody arrangement. The custody arrangement. Her ex-husband's death had left her with Marcus and a recommendation from JG that she maintain civilian employment status for custody reasons, that military deployment would complicate the court's perception of stability. Undercover work at a civilian hospital had seemed like a careful balance. She was employed, she was stateside, she was playing the long game for her son. Now that balance was collapsing. Understood, sir. One more thing. Dr. Mercer filed false charges with the state board. The FBI has been monitoring your case for obstruction. We're letting them proceed. He'll be prosecuted under federal obstruction statutes. You're clear. The call ended. Megan sat in the darkness, her phone still pressed to her ear, and felt the peculiar sensation of being hollow, all the adrenaline, all the focus, all the purpose draining out like blood from a wound. The folded flag sat on the coffee table where she'd brought it down from the bedroom. 6 years she'd carried Petty Officer Martinez's colors. For patients dead at Bagram. Emma Hayes alive because Megan had recognized a tension pneumothorax in a pediatric patient when Dr. Mercer was still standing in the corner shouting about protocol. That was her calculus. That was how she'd learned to live with the 4. 1 saved child for every dead one. She wasn't sure the math worked anymore. That night she watched Marcus sleep, his small form under a blue blanket with stars on it, his breathing even and peaceful, and entirely unaware that his mother was trained in 17 different combat medical procedures, that she'd held people's organs in her hands while helicopters landed around her, that she'd been fired from a job she'd never officially held by a doctor who had no idea who he was actually destroying. She wondered if this was how it ended, not with some dramatic collapse, but with her sitting in a dark apartment and understanding that she'd sacrificed her civilian cover for the same reason she'd sacrificed everything else. Because someone had to. Because the alternative was watching people die when she could have stopped it. Because Emma Hayes had reached for her hand before the code, a blind girl looking for proof that someone was listening, and Megan couldn't not answer that call. 3 days later, she returned to Cedar Creek Medical off-duty, wearing jeans and a button-down, no scrubs, no badge. She wasn't allowed to be there. Her credentials were suspended. But she could visit. Commander Hayes was sitting beside Emma's bed in room 4, reading aloud from a braille book, his seal trident gleaming on his chest. The blind girl's small fingers traced the raised dots, and when Megan appeared in the doorway, Emma's head turned toward her voice before she'd even made a sound. That was the kind of hearing only children developed, learning to navigate a world of sound instead of sight. "Is that the lady who helped me breathe?" Emma asked, her voice clear and curious. In the next bay over, in ICU room 5, a 52-year-old man lay in the cardiac care unit with heart failure, admitted 2 days prior. He was an Iraqi translator, thin and exhausted, with the particular weariness of someone who'd spent his life translating between worlds and always losing something in the process. When his eyes found Megan's face, his body went rigid. The monitors beside his bed accelerated slightly, blood pressure rising, heart rate climbing. His hoarse voice, rough from intubation, cut through the quiet like a blade through silk, iron angel. Megan felt her knees weaken. She hadn't heard that name in 6 years. That name belonged to Bagram. That name belonged to the ghost story soldiers told about a woman who held a hospital alone while the world burned around her. Commander Hayes' head snapped toward the Iraqi man, then back to Megan. His seal's eyes, the kind that had learned to see through lies and deception, locked onto her face. He pulled out his phone. One sentence, "I need verification. Now." The Iraqi translator continued in broken English, his voice trembling, "Bagram. 2019, She-Hold Hospital. 16-hour. Everyone else evacuate. She stay." The room seemed to compress around Megan. Months of careful identity, of being the quiet nurse, of absorbing insults and isolation and deliberate humiliation, of keeping her voice soft and her hand steady and her military precision hidden under a veneer of civilian competence. All of it collapsing in a single moment because a refugee she'd saved once had walked through Cedar Creek's doors looking for dialysis and found instead the woman who'd refused to leave him bleeding on a surgical table while the medevac helicopters came under fire. The army medic stood in the corner of the ICU, Dr. Patel, watching this unfold with dawning recognition on his face, and Megan understood that some secrets weren't secrets anymore. Some truths, once they started breaking free, moved like tsunamis, gathering force, becoming unstoppable, destroying everything in their path until the shore was changed forever. The Iraqi translator in Cedar Creek's ICU had been a refugee for 14 months, his heart failing at age 52, and when he saw Megan standing in the doorway of Emma Hayes's room, off-duty, still in scrubs, no badge, just visiting, his monitor spiked. His fingers trembled reaching for her hand. He whispered hoarsely, voice like wind through a bombed-out corridor, "Iron Angel." The name hung in the sterile air like a prayer in a language no one else understood. Megan's body went absolutely still. Her hand, steady as a surgical laser, remained on his wrist, counting his pulse, but her eyes shifted. That single moment of recognition was enough. She saw it register on his face, the understanding that she had heard him. That she knew he knew. Commander Hayes stood in the hallway, reviewing Emma's latest imaging, when Megan emerged from that room. Their eyes met for exactly 2 seconds. No words. He watched her move back toward the nursing station with that terrifying fluid precision of someone trained to operate in conditions that would paralyze most people, and something shifted in his understanding. He stepped into the bathroom, locked the door, and made a phone call. His voice was clipped, military, giving his brother's name and a single code phrase, "Iron Angel is here." 2 hours later, a Marine colonel in dress uniform walked through Cedar Creek Medical's front entrance carrying a leather citation folder the color of aged cognac. The colonel moved like a man accustomed to command, his bearing making the hallway air pressure change, and he asked for Megan O'Brien by her true rank, captain. Not nurse. Not civilian. The pediatric ICU staff parted without speaking. Megan sat beside Emma's crib, holding the child's small hand, monitoring the flow rate for antibiotics, finally treating the infection that had stumped every specialist in Texas. When she saw the uniform, she stood without hurrying, without fear, the way someone stands who has already survived the worst this world has to offer. The colonel opened the folder. His voice carried across the unit with the weight of official record, Captain Megan O'Brien, Navy Nurse Corps. Silver Star recipient. For extraordinary heroism during combat operations at Bagram Airfield when she held a field hospital alone for 16 hours under enemy fire, treating 63 wounded personnel, performing emergency surgical intervention without support personnel or backup, maintaining medical function despite direct enemy engagement, and refusing extraction until the last patient was stabilized. He paused. "The Navy thanks you for your service." The room went so quiet you could hear the heart monitors individually, each beep like a metronome marking time. Nurses stood frozen. Residents stopped moving. The fluorescent lights buzzed overhead, indifferent. Then the doors at the far end of the ICU opened, and a 2-star general in dress whites entered, his uniform bearing insignia that commanded respect in ways no hospital title ever could. He walked directly to Megan, rendered a sharp salute, fist to chest, held for 3 seconds, and his eyes found the folded flag in her bag, the one she carried everywhere, the colors from her fallen teammate Martinez who died at Bagram 6 years ago. The flag she'd held through every shift, every humiliation, every moment of doubt. "Captain," the general said quietly. "Welcome home." Dr. Mercer pushed through the growing crowd, his face already red, his voice climbing octaves. This is obviously fabricated. I contacted her references. I found discrepancies. She's a fraud, a protocol violator. She performed procedures without authorization, but his voice cracked mid-sentence because the FBI agent who had entered behind the general was now walking toward him, reading rights, and 3 words made everything collapse: forged documentation charges. Security footage played on the unit monitor within the hour. Midnight. Records room. Dr. Mercer alone, his hand shaking as he photographed pages, physically altering Megan's employment file, creating evidence of her fraudulent credentials. The medical board would see it. The state investigator would see it. The federal prosecutor already had. The network of board members he'd called in favors from 3 phone calls, he'd made 3 phone calls to bury her, were already issuing statements: "We were misled by Dr. Mercer's false documentation. We are fully cooperating with all investigations." Protecting themselves. Abandoning him. His medical license suspended within hours pending criminal trial. The nurses who had stood and left when Megan sat down in the break room, their chairs scraping in coordinated exodus, now watched Dr. Mercer being led out in handcuffs past the same people he'd trained, supervised, elevated. Past residents who owed their positions to his recommendations. Past nurses who'd believed his rumors. Past the administrator who was already calculating liability for pediatric deaths traced to equipment Mercer's procurement connections had supplied, falsified inspection records bearing his signature, and his systematic obstruction of the one person investigating it. The perp walk ended with him in a federal vehicle, his radio squawking, his wife calling a divorce attorney by evening, his legacy reduced to a single headline: "Prominent physician arrested in medical equipment fraud and obstruction of federal investigation." Dr. Patel approached Megan as the ICU settled back into its rhythm. He stood beside her at the medication cart, and when he spoke, his voice carried the weight of someone who'd made a choice and was living with its consequences. "I recognized you. At Bagram, I saw the reports. I should have said something, backed you up." Megan's hands continued their work, precise, unshaking, pulling medications, checking labels. When she answered, her voice had dropped an octave. "You would have compromised the mission. For children died before we could prove the equipment was contaminated. Your cover would have protected no one." She turned to face him. "You're here now. That's what matters." Emma Hayes slept peacefully in her crib, her infection finally responding to proper treatment, her vision returning as the underlying inflammation resolved. No longer the mystery that had stumped everyone. The contaminated equipment had been removed, catalogued as evidence, traced through a supply chain that led directly back to Dr. Mercer's financial connections, kickbacks deposited in his wife's account, purchased by his silence, maintained by his obstruction. The FBI agent had detailed it all with the precision of someone trained to build cases that would destroy carefully constructed empires. The folder in the general's hand had documented it: Megan's authorization for emergency surgical intervention under combat conditions, her qualifications exceeding most civilian physicians, her training spanning 23 years and 4 tours, the weight of her experience making her credentials shine like the medals they'd awarded her. Silver Star. 2 Purple Hearts. And 1 Navy Cross, the highest honor short of the Medal of Honor, hanging from a ribbon in a shadow box at her home, the one she didn't talk about because the story required explaining 16 bodies she couldn't save despite trying. But Emma's body she had saved. And 11 others here, though Mercer's obstruction had cost for their lives. Megan touched the folded flag in her bag, the colors worn now from 6 years of carrying them, from pressing them against her chest in hospital bathrooms when no one was watching, from sleeping with them under her pillow on nights when the weight of failure felt too heavy to carry alone. That flag would come home with her tonight. It would sit on her kitchen table where her 8-year-old son would finally understand why his mother was a hero instead of someone the system had tried to destroy. When Commander Hayes returned to the ICU the next morning with fresh labs showing Emma's infection completely resolved, his eyes found Megan at the nursing station. He placed the results in front of her without speaking. Clean. Completely clean. His hand remained on the paper for a moment, and when he removed it, his eyes were wet. He nodded once, military to military, and the salute he rendered was quiet enough that only she saw it. She returned it with the same precision she brought to everything, measured, controlled, absolute. The Iraqi translator whispered her code name one more time as she passed his room, Diane Angel. And Megan paused, just briefly enough to nod, just long enough for him to see that the woman who'd held a field hospital together under fire was still the same woman, still carrying her people with her, still refusing to let anyone suffer alone if she could prevent it. If you ever face a moment where everyone tells you to give up, where the system tries to break you, where the stakes feel impossible, remember that the quietest person in the room might be the one holding it all together. The ones who have seen the worst often give the most. Subscribe for more stories of heroes hiding in plain sight, like and comment if you've ever been underestimated and proven everyone wrong, and share this with someone who needs to hear that giving up is always a choice, and some of us simply refuse to make it.